Let's now take our attention to the Western region, and the streets of Secondary Takoradi have been besieged by mentally challenged persons. Viasat-1 video journalist Agyei Annim reports that the situation is as a result of the absence of a mental health facility in the Secondary Takoradi metropolis.
This is not Ankafo, Pantai or the Accra psychiatric hospitals, where it is common to come across mentally challenged persons, but the street of Secondary Takoradi. These mentally challenged persons, for lack of proper mental health home and care, are left in tattered clothes, loitering around at the peril of people's lives. To find out if there is any intervention for these mentally challenged persons, I talked to the coordinator of the recently established Western Regional Mental Health Subcommittee.
So far, you can see a lot of people on the street of Takoradi that are having mental illness. You see them on the street. You can even behind me, you can see one woman there who is in the middle of a market circle here. So there's a lot of them on the street. But the question is, how do we handle them? Why should they be on the street? Should they be on the street at the first place? No. You see, that's one of the mandates of the Regional Mental Health Subcommittee. The mandate is to make sure that we clear the street of mentally ill people. But the question is, how can we do that? Funding is a challenge. And then when we even clear the street, where are we putting these people for treatment? It's another challenge. So you see that there's a lot of things working against us as the regional staff committee. And we don't have any specific place, because you realize that all our health facilities are all running OPD services. The OPD services means that we send a patient to the hospital, they see them, they ask you to go back home.
Though major hospitals like the Efiang-Kwanta Regional Hospital must have dedicated ward for mentally challenged persons, my checks with the Deputy Administrator revealed otherwise.
I think sometime last year, 2015, we planned having about 10 beds in a dedicated ward to manage mental cases at the inpatient level. But we could not carry that out. In terms of a doctor specializing in mental health, we do not have that in the regional hospital Efiang-Kwanta. And I'm happy if the regional mental health committee is active together with us as a hospital. We should be able to do that. As a major referral hospital, if you hear that there is no admission for severe cases of mental condition, is bad.
The Mental Health Act 846 of 2012 demands the taking away of all mentally challenged persons off the street to be kept at a health facility such as this. But unfortunately, in the Western region, the only facility that is providing rehabilitation services to such mental health challenged persons is this Holy Child Health Center here in Agyei.
The center has various activities. We have the general OPD, RCH, which is mother and child care. We have the maternity and the mental side. We do consultation and rehabilitation of the mentally sick. What we have done so far is taking the people, some of them out of the streets. And then even some of them, the families didn't know how to handle them. And now we have taken that burden from them. Because as they are here, you will see some of them, they couldn't do anything themselves. But now they are able, because we engage them in all the activities we do here. If it's cooking, they are part of it. If it's cleaning the place, they are part of it.
Despite the good work the Holy Child Health Center is doing, Sister Georgina Dozing tells me it is not receiving the needed support.
So at the moment, we have only one mental health nurse whom we sponsored here. So our most challenge is psychiatry nurses. We ask and they are not forthcoming. So if they could add more psychiatry nurses to us, our work will be very, very easy. And another one is sometimes when the medication is short in the system, because we all know that in Ghana, mental health is free, but sometimes it's not free. Because we don't get the medication, so we have to go to the market, buy it, and come and give it to them.
The Mental Health Act and the establishment of regional mental health subcommittees may be in force, but without adequate funding and resources, the fight for mental health care is bound to fail. Reporting for Viasat-1 News, I am Agyei Annim, Takoradi.
A non-governmental organization